think that we have come far. And first, the conversation on hepatitis and treatment was in stakeholder level, where doctors will meet and whisper about it, where researchers will meet and debate about it. But now, a lot of Ghanaians know what hepatitis is. I think the most important conversation, or the thing that we are supposed to push now, is to look at the stigma, attack to the positive, and create a psychological and social network, social net, that the people who test positive can fall within, and increase advocacy on stigma, so that women are not divorcing their husbands and husbands are not divorcing their women. I think that is one. The other thing that we need to look at is that early prevention is key. So I think we need to focus more there, so that people who have tested negative already will just be interested in getting the vaccines and not thinking that they are immune to the disease. And then I think another thing that we should look at and push government to become more ambitious about is the baby dose. 24 hours after a child is born, that child is prevented completely from ever having hepatitis. I know that the government is really interested in it, and we should become more ambitious and bring the conversation down to the KIO level, to the bank manager level, to the teachers level, where everybody knows that government is interested in this policy, and we should help him do it by requesting for it. I also think that if we are going to be able to eliminate hepatitis in the next 4 years, as WHO is suggesting, then everybody must play their role. I really respect the vim that Ghana Health Service is pushing in this time. I hope they don't dig us, as all Ghanaians, when the floods come, we all wake up and clean. 2 weeks later, we dig us. When on 1st January, we go to 31st December, pray. By May, we dig us. We shouldn't use the fire service technique, where during July, we wake up and then by October, we degas. So I think these are the conversations we would be having, not at the stakeholder level, but on the street level.
Okay, thank you so much, Bra Kwame, for your submission. We are very grateful. Doug, Bra Kwame mentioned something on testing for children. What age should we start the vaccination or testing for children?
So vaccination for children is the key thing, not necessarily.
Doc, we can't hear you.
Can you hear me now?
Yes, it's much better.
All right. So vaccination for children is one of the most important things. In fact, it's the single most important cost-effective way of preventing liver cancer in the whole world. When a baby is born, if within 24 hours of birth, they are given the hepatitis B vaccine, and then subsequently, as part of the normal routine immunization, they are given vaccination at 6, 10, and 14 weeks. Then they are protected for life against getting hepatitis B. And that's one of the most important interventions we can make to prevent liver cancer. And that's something that we owe to the future generations. Testing is important for everyone. If you are a Ghanaian today and you've never tested for hepatitis B or C, or you are a Ghanaian today and you don't know your status, then you are doing yourself a disservice. You need to do a hepatitis B and C test at least once in your life. If you are even only going to do it once is almost good enough for us to know whether you need to be vaccinated or whether you need to be put on treatment, so that we can take it from there. So that's why vaccination is important and testing is important. If you test for hepatitis B and you are negative and you've never been vaccinated, then you have to go and get the vaccine and make sure that you take the full 3 doses, so that you'll be protected. Thank you.
Thank you to Doug for this submission. Um, if you just join us, this is the Good Life Chat Room show of the Ghana Health Service. We do this every Friday, 7 p.m. And we have topics that we talk about every Friday. But tonight, we are discussing hepatitis, viral hepatitis. So if you have any questions on hepatitis, this one, you're not paying for any consultation. We have our doctor here to answer any question that you want or you have. And the doctors will address them for us. So leave your comments and your questions in the comments box, and I'll read them to our guests to answer them for us. Though one of the biggest concern about hepatitis is that many people don't even know they have it. Why is hepatitis often called a silent disease? And what are the common signs and symptoms when they do appear?
Okay, so the most common sign and symptom is no sign and symptom. Many people will walk around feeling very well, okay, very healthy, but they could be harboring hepatitis B or hepatitis C because it often doesn't cause any symptoms until it's too late. So by the time that somebody is coming to the hospital with yellowing of their eyes or their feet being swollen or their tummy being bloated, then the disease is already advanced. So it's called a silent killer because most of the time many people will walk around not having any sign, any symptom. Meanwhile, the liver is slowly being destroyed by hepatitis B or hepatitis C. If we take the expected 3 million people in Ghana who we think have hepatitis B and the 500,000 who we think have hepatitis C, less than 10% of them are aware that they are carrying the virus. So you see that there's a huge gap. For hepatitis B, it's even less, okay? Many people, more than 90% of people who have hepatitis B don't even know that they have it. And that's a big problem because we won't be able to achieve elimination if we don't know our status and if we don't link ourselves to either vaccination or treatment.
Dog, it looks like you are muted. We can't hear you.
Why did you lose me?
So, you can continue. Yeah,
So, as I mentioned, many people don't have signs and symptoms. I think you heard
yeah,
that. Right? Yeah.
yes, dog.
When the disease is advanced, when the liver has been destroyed, it's at that time that it will stop working. And by then, the tummy will start getting swollen, the eyes will turn yellow, the feet will be swollen, the person could even vomit blood. By that time, the disease is very advanced that as doctors, when you come to the hospital, we will do what we call supportive care. We are going to make you comfortable. We are going to try and reduce the pain or the suffering that you are going through. But by that stage, treatment options are very limited. So the best time to actually deal with viral hepatitis is either before you get it in the first place, by us giving you hepatitis B vaccination to prevent it, or testing you very early so that we can know your status and we can give you treatment if you need it, or we can monitor you if it's necessary. One big mistake that sometimes is made is that somebody will test positive for hepatitis B and then they'll say, oh, the disease is inactive, so it means you don't need to do anything. Then they forget about it. That's a big mistake. Because once you have hepatitis B, at least we have to be monitoring, we have to be following you up from time to time. We'll check your liver and make sure that there's no sign that there's any problem occurring there. We'll do some blood tests and check that the virus is not dividing too much. If we see any sign that any new problem is coming, immediately we'll put you on treatment. So, as I've said, if you are hepatitis B positive, don't just say, oh, it's inactive, so I'm not going to go for follow-up. At least once a year, you have to go for checkup. If you are hepatitis B negative, at least you have to get vaccinated if you've never been vaccinated. If you are hepatitis C positive, there's free treatment available in all regional hospitals, all teaching hospitals, and even in some district hospitals in the north, so that you can treat the hepatitis C for 3 months and be cured. So it's important that everyone goes out, gets tested, knows their status, gets vaccinated, gets treatment if necessary. Thank you too.
Thank you so much, Doc, um, for this submission. Doc, so let's talk about transmission. How are hepatitis B and C spread, and what are the main difference between the two?
Sorry, the second question, what did you say? I didn't catch that.
So, how are hepatitis B and C spread, and what are the main differences between the two?
So, if we start with hepatitis B, the major way that in our setting hepatitis B is transmitted is through what we call mother to child transmission during delivery or very early in the infancy or baby period. If there's someone in the household who has it, what we call early horizontal transmission. Okay. So, the mother to child transmission is where during delivery, blood from the mother who has hepatitis B gets exposed to the baby during delivery. Because as you can tell, there can be lots of breaks in the skin of the baby as well during the delivery process. And the transmission of the virus occurs through that way. Blood is the biggest carrier of hepatitis B infection, okay? That's why mother to child transmission is such a major route in our setting. The other way, which is horizontal transmission, is from one person to another through blood to blood exposure or through exposure through bodily fluids. In the early infancy period, like if we have a baby or an infant or a toddler less than 5 years, if they get exposed to someone who has hepatitis B, maybe the blood of that person is transmitted to the baby or the infant because the infant also has a break in their skin. So then the virus is able to enter the body. There's a very high chance that that baby or that infant or that child will carry the virus for the rest of their life, what we call chronic infection. If we take a fresh baby who is born, if that fresh baby gets exposed to hepatitis B and gets the infection, they have a 95% chance that they are going to carry that infection for the rest of their life. That's why we believe that the majority of adults who are walking around who have hepatitis B in Ghana, they got it when they were a baby or when they were very young. Okay. Because if you compare that to an adult, if an adult today who has never been, because they are grown and their immune system is developed, 95% of the time they can actually clear the virus. So if an adult is exposed, it's only 5% of the time that they'll actually get chronic infection. Okay. So if we talk about the transmission, mother to child is one major way. For horizontal transmission, it can be through exposure to bodily fluids, And one key bodily fluid aside from blood is also sexual transmission. But we have to remember that sexual transmission is not a very major cause in our setting. So sometimes people will walk around thinking that, oh, this person, they have hepatitis B is because they were promiscuous. Mother or a wife will say, hey, you have hepatitis B, it means you went to sleep around. That's how you got it. That's never the commonest way. Okay, so we should try and break that stigma. Yes, it's possible, but it's not as common as the mother to child or early infancy transmission. So yes, we've mentioned sex is a possible route of transmission, though not the commonest. Now, sharing personal care items, razor blades, sharps, sometimes even toothbrushes, because they're small abrasions that you get when you brush your teeth, etc., can all be a way. When we come to hepatitis C, the commonest way of transmission is through blood to blood contact from sharps, injecting needles, etc. Sometimes we also see people who practice certain things like unsafe circumcision, unsafe female genital mutilation, unsafe scarification. These are all routes where blood can be transmitted from one person to another. Now, sharing personal care items for hepatitis C is also a way in which transmission can occur. So you see that we have to look at the blood to blood exposure. There's often a misconception that things like saliva and sweat and eating together and hugging and kissing can transmit the virus. This is not the case, okay? Sweat does not transmit hepatitis B or C. Saliva does not transmit hepatitis B or C. Okay, hugging someone, shaking their hand, eating together is not a way of transmission. Sometimes people will even say that mothers cannot breastfeed their babies because the breast milk will transmit hepatitis B or hepatitis C. The amount of the virus in breast milk is very negligible. So the risk of transmission by breast milk is not something that we are very concerned about. We are rather more concerned that that baby gets the nourishment that they need from the breast milk as early as possible to promote bonding, whilst we put interventions in place to prevent mother to child transmission, like putting the pregnant woman on medication if she needs it, and making sure that the baby, when they are born, they get the vaccine within 24 hours of birth and the immunoglobulin if it's available. So that's a summary of how the transmission should be approached. Thank you.
Thank you so much, Doc. We are grateful. Bra Kwame, no,
My
Bra
brother,
Kwame. Yes. So, um, one challenge with hepatitis is the stigma. Many
yes.
people fear getting tested because they are afraid of what other people will think of them. How do we how do we change that mindset? And what would you say to someone who is afraid to know their status?
I think that when it comes to advocacy, the most important thing is what Doc just expounded, which is the facts. What are the facts on the ground? So the doctors and the researchers have done a great job finding out what the misconceptions are versus what the truths are. I think it is important for communicators like myself, to now create or curate strategies to go to the market, to go to houses, to go to homes, to meet communities and share with them what the facts are. because it's like light. Immediately it comes on, darkness runs away. So the misconceptions here in this analogy is the darkness. So we need to put more light on what the truths are. That the fact that your wife tested hepatitis positive doesn't mean she's going to cheat on you. The fact that she didn't know, now she knows, doesn't mean she kept something lethal from you. You can't get it through the most prominent way is once people hear the truth. So the answer to the question is that let us create more avenues for communication. I mean, you see that when politicians are coming into power, you see that they use what in marketing we call IMC, which is integrated marketing communication strategy. You see billboards, radio drama, social media, influencer marketing. They bring everything, community engagement, stakeholder mapping. They go and meet the chiefs, they meet the people, they make the promises in the churches, at the mosque, even in the shrines. That IMC is exactly what Ghana is supposed to do, plus all the technical things that doctors are doing already, plus all the things that policy is doing already. That a communication curated to meet people where they are is that. And on, you see, imagine if you are driving through Sunyane and you see that the most prominent way, the dominant way to get hepatitis B is from mother to child. Immediately it happens like that, and husband gets hepatitis. He's going home to tell the wife, who will later say, then let us both go and check again and get help. So I think that we need to up the tempo on communication, on advocacy, and on getting more partnership with dominant TV stations, radios, billboards, because 4 years there are buried. So we need to up the tempo, not only on getting free medication, but also intensifying the channels and intensifying the programs through which the channels will reach the people so that the people know what the facts are. Another thing that I think we are not doing, when I was growing up, GBC had Obra and Osofodazi, which was a television drama curated to communicate important messaging week after week after week. You know, one of my favorite sayings is that art is science made simple and science is art made complicated. So, if we take all the difficult things that doctors are unable to communicate in Akan, Dagbani, Gan, and we put them in drama, TV drama, radio drama, we put them in poems, we put them in songs. If we do that, one song will get 2 million views, and then it would have taken the message slightly quicker. So I think that the advocacy should increase, but we need to employ the soft skills of the art so that message may go into the hearts and not just in the ears. Thank you.
Thank you so much, Kwame. And talking about song, well, since you are already in the industry, I'm sure you are cooking something for us.
Yes, I've done one already, but at a check. This time has passed, so we
Yeah.
are working on a new one which is trendy. Some
Okay.
a hepatitis song that can go with a TikTok dance challenge, something like that is what we are working on.
Nice, 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 nice.
Yes.
I can't wait. I know my wife will jump to that. So the way she loves you. Anyway, we'll be getting to your questions or your comments very soon. And dietitian, I see you. Welcome to our life. And uh, Inshira, you're also welcome to our life. I'll be giving you opportunity to talk very soon, Inshira. So this is the Good Life chat room of the Good Life of the Ghana Health Service. You do this every Friday from 7 p.m. going, and every Friday we have a topic that we discuss. But tonight we are talking about hepatitis, and we have Dr. Yvonne here to help us understand what hepatitis is. The common ones that we normally get in Ghana. That is the B and the C. So if you joined late, we'll be cutting this bits and be sharing them on our social media platform. So if you are not following us, kindly hit the follow button so that you will get notification once we post any of these videos. And also, if you've not shared a live, try and share this live so that it will reach a lot of people for them to join. And you might be saving somebody, who knows? Yes, and also drop your comment in the comment section, and we we will do justice to it. Dog. So one thing that we want to talk about after transmission is prevention. Can hepatitis be prevented?
Yes, viral
Okay.
hepatitis B and C can be prevented. Okay, the first thing that we should think about when it comes to hepatitis B is hepatitis B vaccination. Okay, so we've spoken about the fact that for newborns, the government is working on rolling out what we call hepatitis B birth dose vaccination. That means that right from birth, within 24 hours that a baby is born, they'll get the first dose of a hepatitis B vaccine. This means that if, for example, the mother has hepatitis B, at least there's a first barrier to the baby getting mother to child transmission. Or if somebody in the household unknowingly has hepatitis B who handles that fresh baby, that baby has already received protection from the minute that they were born. Okay. Then they would continue the routine childhood vaccination at 6, 10, and 14 weeks. Now, for adults, many adults who were born before the year 2002 did not get the routine childhood immunization against hepatitis B, okay, because the government introduced routine infant immunization against hepatitis B in 2002. So if you are born before 2002, then you may not have been vaccinated. What that means is that if you have not been vaccinated against hepatitis B, first of all, we have to test you. If you test and you are negative against B, or if you are negative for B, then you qualify to get vaccinated. For an adult, you need 3 doses of the hepatitis B vaccine. If you take the first dose at day 0, 1 month after that, you take the second dose. And 6 months after the first dose, you take the third dose. It's important that you get 3 doses because that is what offers the best protection. After those 3 doses, if you are a general person walking around, you don't need a booster. The vaccine protects you for life. Okay. The most important thing is that you complete the vaccination series. If maybe you started the vaccination and you didn't complete it, then you need to be assessed again, either for possible revaccination from the beginning, or we may be able to give you a third dose if you had already received the first and the second dose. Okay, so that is vaccination against hepatitis B. Currently, there's no vaccine in the market against hepatitis C, but we can still prevent it because we know the way that it is transmitted. So we know that lifestyle and everyday preventive things are important, not sharing sharps, injecting drug use, preventing sharing needles, preventing sharing personal care items like razor blades, nail clippers, etc. are all ways that you are minimizing risk of transmission, both for hepatitis B and C. Okay, so those lifestyle things to prevent transmission are just as important as also the vaccination that we've spoken about against hepatitis B. Thank you.
Thank you so much, Doc. for this submission. Somebody is asking, what is the difference between hepatitis B treatment and C treatment?
Okay, so I think that was the other part of your question. What's the major difference between the two? So
Yeah.
the type of virus that hepatitis B is, we call it it's a DNA based virus. That means that it will end up incorporating itself into our cells, and it will continue to multiply and multiply and multiply. So once it's done that, the medication that we are giving for hepatitis B, we are giving it to prevent that multiplication, or what we call replication of the virus. Okay. So I say that hepatitis B means B for bearable. It means that we can bear with the virus through medication. Okay. The difference is that with C is an RNA virus, okay? And what that means is that if we give the medication to prevent that viral replication, we can clear the virus from the body. So C, curable. Hepatitis C is curable. So the treatment for hepatitis C can cure you 95% of the time if you take the medication every day for 3 months, okay? One key thing about hepatitis C is that if you are treated for hepatitis C and you are cured, and you go away and you go and do the same thing again, injecting drug use, sharing personal care items, not looking after yourself well, you can get reinfected with hepatitis C, and we'll have to treat you all over again, okay? So hepatitis C is like malaria. We treat you, if you go out and the mosquito bites you again, you can get malaria again, and we'll have to treat you again. But if you were sleeping under your bed net, or if you were preventing yourself from getting exposed to the virus, then you won't acquire the infection again, and we won't have to treat you again. Okay. For hepatitis B, once we put you on treatment, it's like somebody who has hypertension or diabetes. We'll treat you till longest time, because the same way that when you are taking your BP medication or your diabetes medication, we are trying to bring down the blood pressure or bring down the blood sugar. That's the same way that the hepatitis medication, we are to bring down the virus and keep it down so that it cannot affect the liver or cause damage. So you treat hepatitis B long term. That's why I say it's B for bearable. We bear with it long.
Doc, your line is off.
I'm done. Oh, I'm done.
Okay. All right, Doc. So thank you for that. Somebody is also asking, I'm trying to, yes. Sorry. I'm trying to get the question for you. But if you just join us, this is the Good Life chat room of the Ghana Health Service tonight. We are talking about hepatitis. Yo, yeah. If you have any question or contribution, just leave them in the comment box, and we will read them to our guest. Living with hepatitis still live healthy and productive life.
Absolutely. There's no reason why they can't live a healthy and productive life. They don't need to stop working. They don't need to stay at home and take sick leave. They don't need to ostracize themselves from society. They can live a fruitful, healthy, beautiful life, okay? There's no reason why you cannot do that. The important thing is that at least once a year, go and get a checkup so that we can check your liver, we check the virus in the blood, and we make sure that things that we can control are controlled. One mistake that is made is that somebody is diagnosed with hepatitis B, and then they say that, oh, the disease is inactive, so that's the end. 10 years later, 15 years later, that person may come to the hospital, they've developed liver cancer. We were monitoring that patient at least once. If they were going to get cancer, if the cancer started or when it would have started, we would be able to pick it up early. Okay. So just make sure that you go for your frequent, at least once a year, checkups if you have hepatitis B. But outside of that, you can eat almost everything. You just have to make sure you avoid herbal medication. You have to make sure you limit your alcohol consumption. You make sure that you eat a balanced diet and you'll be fine.
Yeah. Okay. Inshra, if you can hear me, welcome to the live. Inshra, can you hear me? Yes. So this week you've been going to TV and radio station helping with the advocacy. Inshra, can you hear me?
Yes, I can hear you.
Oh, great, 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 great. So I have one question for you. What are some of the biggest misconception people have about hepatitis? And
Thank you very
also,
much.
can someone get hepatitis from sharing food, hugging, or shaking of hands? Those things. Yeah.
So, thank you very much. This has been one of the things that stigma. Ɛtwitwe nkurɔfoɔ bebree na ɛkɔ wɔn akyi. Ma wɔntumi nya insecure healthcare no. Ebi dwen sɛ ɛyɛ nnome. Ebi dwen sɛ obi na ɔde abɔ ne dua. Ebi dwen sɛ obi na ato sunsum yareɛ ɛna obi atɔ ama no. Nti onye bi a insɛ sɛ nka ɔbɛba ayansabea na nka yɛahwɛ no no. Ɔbɛpɛ prayer camp bi na ɔde akɔ akɔto. Forgetting say hɔ na wakɔ akɔhyɛ no obetumi ɛde assign ɔmo a ɔne ɔmo te that area hɔ mo nom no. Yɛhu sɛ nhwehwɛmu bebree ama yɛhu sɛ hepatitis yare no ba wo so a wobetumi ne nipa no ato nsa edidi. Wobetumi ne nipa no atena fie. Wobetumi ayɛ na awa atu, and that even ɛno na ɛma nipa no brɔfo kasa bi ɛka no psychological support ɛma ɛhyɛ no kina sɛ ebusua mpoo me, nnamfofoɔ mpoo me, enuanom mpoo me. Enti no, irrespective say menye yare no, ebusua no da so a ka mefua. Eno no ma nipa no etimi nya apomeden, etimi gina so nya enum nedro na otumi benya ahoɔden yie. Ba se ekoba se ye twetwe ye ho fi nipa no ho, ekoba se ye na akwa, ana ekoba se ye de ye ne ho fi de ye pese no ne bekasa a, eno ekra ma nipa no etimi ehwe no nkwantem. Esen se nipa no betena ase na wanya apomeden na watoa na edru a onom no so. Ye nyina ye hu se hepatitis C nyame adom edru wo ho mo nom a se obi nya bisisi ya na de no to so a acha na 3 months nipa no ho beto no. But hepatitis B na nka plan e wo ho no, most of times in my practice ye community koko bodawro ebon edi nkomo kire ye communities ne ade na obi wo mo no mo hwe wani din wo ka say we are obi say say free na ya ka say free. Enti ehwo no I see say it's becoming a barrier to some people coming to test, because testing no free. I believe say with advocacy na ye no government betimi afa no aye no routine ye nim say ye for oba ye ya pemfo ne ade a ye hwe saa adwoma ni nyina wa abra o ma ba ya sabia ye hwe hepatitis B, ye hwe HIV, ye hwe syphilis, ye hwe no triple elimination no ye hwe no na mmom no the general population I was say abaitimi test kits no free compulsory mo obi bia say na be ya enko e say kokotua enti miniska dia mintimi nye na afi vaccination no so for adults no omo ntimi wo vaccines 3 ni nyina no nka aban betimi aye ne free na obi etimi awo pane ni bi ne ode abo no ho ban, and then we can continue to the next generation on beba no with the Hep B bed dose bebo within 24 hours ntinka akola ne benyi no na wonya protection for the rest of the life na yetimi eliminate hepatitis B na hepatitis C ade ni nyina akofom na afei Ghana ne ye youth no apomede no esipi esita medase.
Thank you so much, Ishra, for this education. We are
Prince,
we are
Prince,
grateful. Yes.
mɛtumi de biribi aka ho kakra.
Oh yes, Doc. Bacho, go ahead.
Me ne ne yɛ adwen paa deɛ waka no. 100% I agree with him. But the other thing I want to add ne say, ɛwɔ mu mmom sɛ it would be great sɛ government no ebetua for vaccination, ebetua for testing. Ɛno na yɛn nyinaa yɛ wish. Until sɛ government betumi ayɛ saa no, ɛwɔ sɛ yɛdwen yɛn ankasa yɛn ho. Sɛ ɛyɛ asɔre na yɛkɔɔyɛ na ɔsɔfo kaa sɛ yɛn nyinaa yɛnto collection na yɛmfa nsi wall anaasɛ yɛmfa ntɔ new altar anaa yɛmfa nyɛ sei mma asɔre a, anka yɛbɛma saa sika no na yɛde ayɛ because we are putting we are sowing a seed into the development of the church. But let's sow a seed into our own lives. Hepatitis ọbẹ̀wárí a ọkọyẹ test no. Sisi a 20 cedis, ubetumi test hepatitis B, ubetumi test hepatitis C. It is better say ubeye saa test no na wehu status because sorry anka watu saa collection no. I'm sure say Nyankopon mpo be forgive you say Sunday we instead of say anka to collection o de ko test hepatitis B and hepatitis C. Now they are born ho by vaccine no one dose 15 cedis. Ufa 3 doses now 45 cedis. Who decide say every week bia o de 10 cedis beto ho. By the end of how many weeks or months, ubenya saa sika ne de akoto vaccine no. Inti whilst yes, menene ya adwen say enkaban betumi etua a good idea no. Let's also sow a seed into our own lives because better say ube prevent hepatitis B no than say ubenya na every month no was say utia 250 and na 300 cedis say wo de to edro. Inti saa na me so me pese me de ka ho. Thank
Okay, Doc. Obi Busa or say yeah, akra for vaccination a free and
Inti se say ano birth dose vaccine na ye no government intend say de beka childhood vaccination ne ho na aye free. But again, until say ebesha asie no, birth dose vaccine no, ne bo onye den sa. Se woye apemfo na decide say me baby ya mewu ni. The same way a mekọ akoto eche, mekọ akoto atade, mekọ akoto say ama baby no. Meto birth dose vaccine nso aka ho ama no 15 cedis ana 25 cedis ana whatever price aye. Na me de abo me ba ne ho ban. Sir government starts here great and no the whole country baby bia benya. But until that time na ebesi no, me protecting me baby against hepatitis B.
Doc. Obisu Busa or say or yeah negative, but niknu yeah positive. And see age ben obetimi vaccinating them crano.
Akola no say okowe na from 6 weeks, 10 weeks, 14 weeks. Obewo penta vaccine. Hepatitis B vaccination no, ewo penta vaccine no. Inti as long as Akola no was born after 2002 no, ewo say oye vaccinated.
Okay. And somebody too is asking us, is the 3 dose of Hep B vaccine for life, or you would have to repeat it after some years? So, Doc, I answer question where or say, if you are not a health worker, I mean, no need for you to go for any booster. And so the 3 doses are okay. And our dog may boy.
Yes,
Okay. All right. Let me see if we have any other question. Please, what if you test Hep B positive after being screened? So, Doc, okay, Doc, if you can touch briefly, what if you are positive? What should you do?
So if you are Hep B positive, go to the nearest health center and get the follow-up testing that you need. Okay.
Okay. All right. Thank you so much, Doc. Bra Kwame. Bra Kwame.
Yeah, me nua me wɔ ha.
So before we wrap up, your music has been an inspiration to many people. Personally, yes. And I mean, if you could speak directly to every Ghanaian watching tonight, what one message would you leave them about hepatitis B in tree, into the Nkani tree? Like your message to Ghanaians.
Medwen sɛ
Yeah.
ewiase nyinara nimdeɛ ɛwɔ wiase nyinaa, psychology, sociology, biology, chemistry, physics, maths, literature, whatever. Nimdeɛ a ho hia wɔ wiase paa ne nkwa. Na ɛsɛ ka free class 1 a akɔpem university. Yesua life nkwa.
Bro Kwame, it looks like your line is going off.
Ma yeah kofo anu omo
Aha.
interacting nyinara. Ni nyina sie ni nkwa a yentumi nye. But ewiase education system no enhu saa emofra adwene ya ma ekire. Enti wo ho em said the father of ancient medicine, a friend say researcher, the Herodotus and I say Hippocrates. Or say if you are not your own doctor, you are a fool. Into wo wiase a menka say wa kwatiti nro nom brano koye test ko test nyoma, check your blood levels, check Hippocrates, check your blood levels, check your weight, check hu sene wakoma ye adwuma sene lungs ye adwuma ko hu brano tell doc kan no wo sie sika de beto shoe a no asie bia de be at least every year bia de be test for show mojem na hu enkwa na ati wo mu no ahoɔden ewom ene yare a ebem ene ne o ma atim said be abetimi asesa wabrabo brano said be ya yare bi mpo ba ana yare bi ba abetimi aso ano ntem enti ma wo nkwa ho hia na eno nti na ati wiase kakra mekan.
Okay, Bro Kwame. Yeah, that's it.
Menas
Dr. Yvonne, Pacho, also, our last message to Ghanaians.
Know your status. Know your status. Know your status. Get tested, get treated, get vaccinated. Anwa na mede beka ho.
If you do us the honors, Munina Mayadi, if you can give us your clap song.
when I win, you win, they win, we all win, and we sing a happy song. Ting-a-ling-a-ling-a-ling. And then to clap for Doctor. Pa.
Oh,
Doc,
thank you
Doc,
so
who ya
much,
guy,
Doc.
what's it? When you go on shout, pa, na.
Also, yeah,
You
guy,
might
yeah,
who
guy.
yeah, you be share Tuesday.
Yes, that reminds me. So, Doc, can you talk a little bit about the lunch on Tuesday?
Sure. So on Tuesday, we are all meeting at the Ministry of Health. We are going to talk about viral hepatitis. All different stakeholders from all the way up to community will be there for us to shine the light on hepatitis in Ghana. Then we are going to launch what we call a technical working group. It just means bringing together different people who can help us come up with new ways of dealing with hepatitis in the country. Now, yeah, press briefing. Yeah, we'll speak about hepatitis so that everyone in the country will hear about hepatitis to eliminate it by 2030. So that will be Tuesday morning at the Ministry of Health.
Okay. Thank you, Doc. Inshra, you mentioned something about herbal hepatitis. So quickly, our time is 70. Really, Bonito.
I just
Herbals. So there are certain chemicals that can cause damage to the liver, and we
the
find
liver. Yes.
sometimes some of the herbal medicines now through FDA approval. No, some of them can damage the liver. And see, because of those bad chemicals na what herbal medications no, it causes injury to liver no. Na fe a cause hepatitis na ama liver na into me nye ejuma yie. Na eni na ye yellow, ye fun na ye kese na na honhon. Inti herbal nso na what say we should be very careful about. If any FDA approved, just call through the necessary regulation, any say you use it because a bit to me damage liver no.
Okay. Inshra, your last words, near uncle.
Yes. A lot many a times in conform any hepatitis now feel say and so they call herbal or herbal grow. America as part of the advocacy they say yes sir. So who hepatitis are really be don't resort to herbal. Come to our facility. They draw home no man. They do better so first na ke do no boarding. Now nyame adom aban ne other partners etumi aka abom edonia ne de go boss na bo no aba form at least now it's 76 Ghana cedis for the hepatitis B, but for the hepatitis C it is free across board. And so we urge everyone who will test positive say Umbra Yayara Sabia teaching hospital, district hospital, regional hospital Umbra ne yɛmfa no nto aduro so dan sɛ ɔbɛkɔ akɔ resort sɛ ɔkɔ akɔyɛ herbal medicine no bɛ damage liver no more because you don't know the dosage, you don't know the content of the herbal medicine, you don't know what was made and it has not been approved. As we speak, you know FDA approval biara sɛ herbal medicine wey etumi sɛ hepatitis yadeɛ anaasɛ ɛnsa yadeɛ nti ɛsrɛ the general public obiara make sure say we are hepatitis yare no bia you come to our facility to access medication. Thank you.
Thank you so much, Inshra. So this has been the Good Life chat room of the Ghana Health Service. We've been talking about hepatitis, viral hepatitis. So if you miss it, don't worry. We will be sharing it on our social media platforms within the week so that you can also watch it and advise yourself. My name is Prince also Banahine Sarkodie. We do this every Friday 7 p.m. So join us next week as we will discuss another topic equally relevant. So thank you everyone for joining. We are grateful, Doc. Dr. Yvonne, you are welcome. Inshra, patient upon NCD. Yes, we are grateful. Sickle cell. Thank you for joining. And dietitian, how you doing? Okay, it looks like dietitian is gone. But thank you. Let's join again. And also, let's follow our pages, Good Life GH. If you are not following us, kindly follow us so that you will have all our content. Yes. So thank you so much for joining tonight, and we are grateful. Bye bye. See you next week.
I'm your favorite rapper's favorite rapper. Rap, yeah, yeah. And I'm in a club with your favorite singer, Maurice Babyface. Milisi kama wa, ubedia manasa, tons mama wa, ube from manapa, see that my wa, nyadi yo binye bida, anka me try me tia ma wo, so boy si akwa dada. Although Nika say cry, Although me and cry.
Wherever you day, whoever you be, oh, no matter your pocket, good life, good for you. You day for now, south, east or west. You be old or young, oh, good life, live it well. Wash your hands with soap under running water. Sleep on the treated.